Namaste. I'm Dr. Sowmya Raghavan, Consultant Obstetrician and Gynaecologist at Apollo OMR. The topic for today is contraception or avoiding unwanted pregnancies. The wish of every eligible couple desirous of pregnancy or a child is to have a safe delivery and a healthy child. This being very important, we also know that it's equally important that they avoid unwanted pregnancies, which is actually underplayed. Many a times there is a lot of health setback in the woman because of unwanted pregnancies, which many of them don't realize. They think that they need not follow any contraception, and if they become pregnant, they have methods to, go in for an abortion. But that is not the right attitude. They should also have planned pregnancies, and being educated, we should try to avoid unwanted pregnancies. So, what are the methods available? There are a wide range of methods available depending on the age of the patient, the medical condition, and the desires of both the couple, that is the husband and wife. They can choose from a wide variety of contraceptive devices. So, let us see what contraception has to offer. To start with, we say in the initial few years of marriage, when they want to postpone pregnancy, or for young girls who are entering into sexual activity, we have the option of barrier method, which is either the male or the female condom. Female condom is not widely available in India, whereas male condom is definitely available, and this is very important because it also protects against sexually transmitted diseases. For people who are in a monogamous relationship, it is always it is good to follow any contraceptive methods, but if there is a polygamous relationship, it's always better that they avoid sexually transmitted diseases as well. Similarly, for married couple who want to postpone, they have the option of barrier method as well as contraceptive pills. See, there are a lot of misconceptions about contraception. People think that they add on weight because of taking pills. Similarly, they have delay in childbirth. Maybe the fertility is affected because of the pills, but that is not the case. We have the latest pills which do not cause any weight increase. Similarly, the fertility returns to normal immediately after stopping the pill. So, supposing the woman is on contraceptive pills, they want to postpone pregnancy for 2 years, it is still fine, because after 2 years, once she stops, the very next cycle she can become fertile. Only when they take the pills for more than 5 years, then maybe it takes about 3 months for the ovulation to resume. So, it is actually safe to take these pills. Supposing now we go on to postponement of say they already have a baby and they want to postpone pregnancy. Again, you could choose between a barrier method or a pill, or you have something called the loop or the coil. See, loop or coil we don't advise for women who have not born children, because there is a slight risk of infection and we don't want the tubes to get blocked because of this. So, for planning or for postponing or kind of spacing your between to space your children, I think it is a good option to even go in for the coil or loop. So, let us see what varieties of coil or loop we have. We have two varieties. One is a medicated and the other one is a non-medicated one. When do we advise a medicated one? When the woman has heavy periods, then it is better to advise a medicated one. Both the coil will both the medicated and the non-medicated provide equal contraceptive benefit. Supposing they have all finished their family and still they want to follow some contraceptive methods, they can choose between a temporary method and a permanent method. Permanent method, we have something called the male sterilization, which is called the vasectomy, and the female sterilization, which is the laparoscopic tubal sterilization, where we kind of clip the tubes or we burn and cut the tubes in between. Now, say there is again a misconception about lactating mothers. They feel that after childbirth, say for a few months or for a year, they can never become pregnant. That is not the case. Post delivery for 2 months, the ovulation does not resume, but after that there is resumption of ovulation. So you have to follow some contraceptive methods, which is again a pill. This pill can be safely taken during breastfeeding because it doesn't interfere with breastfeeding. Also, we have injections which can be taken once in 3 months. Both these do not interfere with breastfeeding. So I would advise all of you all to go in for a planned pregnancy and kindly avoid unwanted pregnancies, because abortions have a lot of harmful effects. You lose a lot of blood, you're compromising on the uterus. So it's always better to have planned pregnancies.